Well, it started when I was about 12 years old, and I remember being in a lot of pain in my stomach at the side, and I had to stay off school, and the doctor came and I was very hot and I felt very lethargic and very nauseous, and they thought I had appendicitis. So I went to hospital and they found out that it was severe constipation.
The severity of the pain would be I would crawl from the car, crawl upstairs to go to bed. I would be doubled up in agony. I would be crying with the pain in my guts and in my stomach.
The symptoms I was suffering from at the time was pain, lethargicness, aching of muscle, and general debilitation, a feeling that I always just wanted to go to bed and stay there.
Hello, I'm Dr. Chris Steele, a GP from Manchester, with a special interest in the irritable bowel syndrome. The purpose of this video is to help you fully understand the condition, make you aware of the possible treatments, and to give you advice and reassurance. We will later be joined by Dr. Peter Warwell, one of the world's leading authorities on the condition. Dr. Warwell trained at Guy's Hospital in London and subsequently worked at a number of different hospitals in this country, developing his interest in bowel problems. He also spent a year in America undertaking research into diseases of the digestive system. He was appointed a consultant gastroenterologist at the University Hospital of South Manchester in 1981, where over the last 13 years he has built up a unit specialising in the irritable bowel syndrome. The department sees patients from all over the country with this disorder and operates an extensive ongoing research programme into the condition. Dr. Warwell is on a number of advisory panels on irritable bowel syndrome, both here and in the United States. The irritable bowel syndrome is mainly a disorder of the large bowel. As you can see, the large bowel goes from the right-hand side of the abdomen across to the left-hand side and right down into the pelvis. Therefore, pain can be felt in places that wouldn't normally be associated with the gut, and symptoms are often misdiagnosed as arising from other adjacent organs. Circular muscles around the intestines contract rhythmically to push the feces along the length to the rectum. With irritable bowel syndrome, the contractions are abnormally strong or irregular. The muscles may act too quickly, resulting in diarrhea, or too slowly, resulting in constipation. Overactivity or spasm causes abdominal pain and great discomfort. This is coupled with increased sensitivity of the gut, which results in pain and an increased desire to move the bowels. Rectal dissatisfaction results from excess sensitivity of the bowel. The rectum believes it is ready to empty, even though there is not enough contents to make it happen.
Irritable bowel syndrome is a condition that gives you a lot of tummy pain, a lot of bloating of the tummy, and some abnormality of the bowel habit. And this can be loose bowels, constipated bowels, or sometimes the patient may vary between loose bowels and constipated bowels. And it is important to point out to the patient that this is a real condition. It's not in their mind. And that the condition is a bit like asthma. You get spasm of the lungs in asthma, you get spasm of the guts in irritable bowel. And this is my hobby horse, that patients should be told that it's not in their mind and it's as real as asthma or migraine or any of these other commonly seen conditions.
Firstly, you're not alone. Irritable bowel syndrome is extremely common. 10% of the population will mention the condition to their doctors, though many, many others have some symptoms but not severe enough to seek medical attention. It is believed that irritable bowel syndrome affects around 20% of the population, particularly women in the 15 to 35 age group. This equates to about 12 million sufferers in the UK alone.
Irritable bowel is an extremely common condition, It's been estimated that probably 20%, that's 1 in 5 of the population, get it at some time during the course of their lives. That doesn't mean to say they all get it badly, but that's a lot of people with this condition. And the trouble is, patients don't talk about their bowels. They don't talk about how much trouble they have going to the toilet or how much trouble they have with wind. These are still not after dinner topics. And so they feel very lonely because they say, I've never met anybody with IBS. And I've heard my IBS patients say, I've heard other people going on IBS about my IBS, but I haven't admitted I've got it myself because people don't like to admit they've got bowel problems. So a lot of these patients are told it's common, but they're not aware of other patients and think they're very alone with this condition. It's a very lonely condition to have, particularly when you're not getting any sympathy from any quarter.
Symptoms may vary from patient to patient. All patients will have at least some of the following main symptoms. Tummy pain, often in the lower left part of the abdomen, and usually cramp-like or colicky in nature, and relieved by moving the bowels or passing wind. Also, feeling bloated as the abdomen is often distended. And there's bowel disturbance. Sufferers may pass more or less frequently than usual. Stools may be less solid or looser with some patients, while those with constipation pass small, hard, pellet-like stools. Some patients may open their bowels several times a day, whilst others may only go once a week.
Our world record patient is a patient who only opens her bowels once every 3 months. And you think, my goodness, where does it all go? But there are extremes, but patients like to hear that because they open their bowels perhaps once every 10 days and think they're a freak. So if you can come out with an even worse case, that's quite useful for the patient. There are other patients who spend nearly all day on the toilet. And so it's quite useful to say to patients, look, I've just seen a patient who's much worse than you, because they think they're the worst patient in the world. You have to be a bit tactful when you say that, because then they think you're belittling their own symptoms. But that's an important thing.
Sometimes a slimy fluid or mucus may be passed along with the bowel movement. And there may be an urgent need to rush and empty the bowels, which can result in an accident if a toilet is not nearby. And after moving the bowels, there may be a sensation of not having fully emptied them. Passing wind or flatulence is also a common problem. And a high percentage of women sufferers may experience some pain on sexual intercourse because the inflamed bowel is so close to the vagina. Other symptoms include tenderness or soreness on touching or pressing the abdomen, short, sharp pains in the rectum or back passage, and burping and feelings of sickness or even vomiting. Now, there are also non-colonic symptoms such as tiredness and backache, which can affect up to 85% of sufferers. Misdiagnosis often results because patients will only mention the non-colonic pains and be too embarrassed to mention the bowel-related problems.
I saw only last week a girl in her 20s who'd had all her gynecological bits and pieces removed. She'd had her ovaries out, she'd had her tubes out, she'd had her uterus out, and still the pain was there. And therefore the doctor said, well, there's nothing else there to be causing the pain in my department. I don't need to see you anymore.
Well, it started when I was about 12 years old, and I remember being in a lot of pain in my stomach at the side, and I had to stay off school, and the doctor came and I was very hot and I felt very lethargic and very nauseous, and they thought I had appendicitis. So I went to hospital and they found out that it was severe constipation, which they said was probably due to my diet and a lack of fruit and fibre and this sort of thing. So then I was put on a very fibrous diet, lots of fruits, for years, but it didn't go and the symptoms got worse. Most people, my friends and my family, just said keep persevering, you know, because they didn't have it and they thought that I was just not eating the right foods, not eating enough, and generally not drinking enough, things like that. It's carried on till last year, really, when I was about 28. So that's quite a span to have it. At the beginning, I went to the doctors regularly, and they said it was constipation, used fibrogels, different drugs, none of which really worked. They were very sympathetic to begin with, but as the things started to diminish and they had nothing left to give me, really, they got fed up of me going. And I started to feel very depressed about it, thinking, well, perhaps it is in my mind, because a lot of the people said, you know, well, perhaps you're under stress. And I think I've heard that from nearly every doctor I've been to. And I'm not a stressful person. I'm quite a happy, optimistic sort of person. When I went to college to do my degree, several times I was taken into sick bay with suspected appendicitis, and I kept saying, no, it's irritable bowel, but I was given all sorts of things and sent off for tests. I've been sent off for urinary tests. I've been in hospital for suspected ovary cysts, ovarian cysts, things like that. The basic symptoms have always remained the same, despite the fact that the diagnosis has always changed. I've had severe backache, I've been very lethargic, I've had a coated tongue, you feel very full, your stomach gets extremely bloated, your clothes feel very tight, it's generally extremely uncomfortable, gives you headaches, makes you very, very ratty. When you're at work, you don't want to be there because you can't perform properly. People think you're making it up. They're not very sympathetic at work. And basically by the time I got to do the hypnotherapy, I'd tried everything and I was at the end of my tether.
To wake up in the morning, I was obsessed at that point with, how will I feel today? Can I put one foot out of the bed? Will I go to the toilet? And that's the obsession that you live with. And if you don't go to the toilet, then you're going to be ill for the day. And your bowels control your life. And the thoughts about your life they're just round your bowel all the time.
There are patients who we see that are so severe that we have to get them into hospital. And people don't realise they can be that bad. And we sometimes have to use what we call a narcotic drugs, opium-derived drugs, morphine, to control their pain. So that gives you some idea of how bad the pain can be. Some of the women with IBS will say the pain is as bad or worse than labour pain.
The severity of the pain would be, I would crawl from the car, crawl upstairs to go to bed. I would be doubled up in agony. I would be crying with the pain in my guts and in my stomach. Very, very severe. I couldn't walk. I couldn't walk very far when the pains were severe. My legs would go numb. So then you're dragging your body along. So you've got a heavy body, you've got pains, so you just want to just curl up and die, really.
There are a lot of symptoms in IBS that aren't necessarily attributable to the bowel problem. They don't seem to come from the bowel. And we are very keen on these because about 50% of the patients that we see put these symptoms as worse than their bowel symptoms. And patients can get backache, that's very common. They can feel very, very lethargic all the time. They can get nausea. They can get pain in their thighs. The women can get gynecological symptoms. They can get bladder symptoms. And the importance of these is that for twofold, really. One is that the patient goes to the doctor and feels a real hypochondriac when they come out with all these symptoms. And they don't. They're afraid to mention too many of them. But the second one is even more important, is that if one of these IBS symptoms is more intrusive to the patient than the bowel symptoms, they may actually get sent to the wrong doctor. If they've got gynae symptoms, they might get sent to the gynecologist. If they've got bladder symptoms, they may go to the bladder doctors. Or if they have back symptoms, they may go to an orthopaedic surgeon. And what's more, they can sometimes actually get operations done with no benefit to them and a lot of waste of time. And of course, if you have an operation, things can go wrong. So this can lead to all sorts of problems. These patients with these unusual symptoms, or not unusual symptoms, but common, but not necessarily attributable to the bowel symptoms, can go to all sorts of different specialties. And the doctor in that specialty doesn't realise they've got IBS and then does all these tests and they come back negative. It's very common in our experience for a lot of the patients that we see with IBS to have been to lots of different specialists before us. And I don't mean gut specialists. They've been to the gynecologist, they've been to the orthopedic surgeon, they've been to the bladder doctors, and they may have even been to a blood doctor because they're so tired all the time. They're thought to have some sort of blood disorder. Sometimes they even think they've got something dreadful like leukemia.
Simple tests will reveal whether these symptoms relate to the irritable bowel syndrome or other conditions such as Crohn's disease, inflammation of the bowel, or even possible tumours of the intestines. Such investigations will include a rectal examination, barium x-rays of the bowel, and actually looking directly at the interior of the intestines with a type of internal telescope called the sigmoidoscope or colonoscope.
There aren't any tests for IBS as such, but you need to exclude things. So if a patient has symptoms that might suggest an ulcer, it's probably best to make sure they haven't got an ulcer. Or if an IBS patient has symptoms suggesting they've got gallbladder problems, it's best to test them for that. But you should always point out to the patient that the tests you are doing are done to exclude other things rather than to help the diagnosis of IBS. Because a lot of patients complain, I went to see the doctor, he did the tests, they were all negative, he said there's nothing wrong with you, go away and forget about it. And that's wrong. The tests don't mean there's nothing wrong with you, it just means there's nothing else wrong with you. You've got IBS, but there's nothing else wrong with you. And so that's the wrong way to handle patients. You do the tests and then say to them, look, nothing else wrong, does seem to be IBS, we'll have to get on and treat it. But you mustn't say there's nothing wrong with you. And there isn't a test as yet, although we're working on it in my department, to diagnose IBS positively. That would be wonderful if we could do something to the patient and say, look, here you are, IBS. Then we'd be home and dry.
The irritable bowel syndrome is often triggered off by anxiety or stress, and even an attack of food poisoning can precipitate a flare-up. Some foods may contribute to the condition, such as wheat-derived products, milk or eggs. Other contributing factors may include lack of fibre or roughage, antibiotic usage, and even hysterectomy. There is also evidence to suggest that the condition may even be inherited.
My view, and I have to state it's my view, but I think it'll probably be right, is that you're born with this tendency to develop this condition, just like you're born with the tendency to develop asthma or migraine, and you're born with this tendency, and then various things provoke it, and therefore stress might provoke it in somebody, but it doesn't cause it. It's just one of many provoking factors for this condition.
I think I first started with irritable bowel syndrome after I had a hysterectomy in 1974. I didn't take much notice of it, I just thought it was part of everyday life, until I had a nasty accident on the M6 in the early 80s. After I got over the accident, I found that I was very, very tired. I had terrible pains in my gut. My limbs ached and my joints they felt dreadful, and I just felt that I just wanted to crawl into bed and stay there and not face the world at all.
There are all sorts of other little factors that you come across that provoke this condition. And we talk in the medical profession about other conditions being multifactorial. In other words, there are lots of different factors. And I think that's the way to think about IBS, that One day it might be one thing upsetting you, and another day it might be something else upsetting you. And therefore, you can't necessarily work out what the hell's caused it on that particular day. And the patients become very frustrated by this, that they say, I'm bad, and I don't know why I'm bad. And I'm bad on different days for different reasons. And so you try and allay that worry that they can't find a thing that sets them off, and say, well, it's different things on different days. Try not to worry about that too much. It's just the way the irritable bowel works, that it will be provoked by different things. Don't worry about that, or try not to worry about it. And of course, if they spend lots of time worrying about what provokes it, that then feeds back on itself. And this is another factor. I keep on about this. IBS is not caused by stress. But if you're stressed by your condition, either by the doctor's attitude to the condition, you keep on getting what you feel is a raw deal from your doctor, or even spouses don't take their spouses terribly sympathetically, or they are just being treated unsympathetically in general, then that feeds back on it. Or if they can't find a cause for it, that makes them frustrated, that feeds back on it. And so this condition becomes all-intrusive. It pervades the whole of their life, and it becomes a very, very intrusive condition.
The irritable bowel syndrome does not lead to any life-threatening problems, and the inconvenience and discomfort will not do you any harm.
I think it is very important to point out to patients that IBS never, never leads to cancer or anything more serious. I almost don't like using the word serious, because I rate IBS as a very serious condition. And so you're immediately belittling the patient with IBS if you say nothing more serious. But perhaps nothing more deadly is perhaps the word, because IBS doesn't kill you, but it makes life miserable for you.
The condition will come and go and can eventually disappear altogether.
Whether IBS is curable, I think, depends on the patient. I think general practitioners see milder patients than I see, and I suspect quite a lot of those patients settle down and really have very little in the way of trouble. The patients that I see, of course, are much severer, and they do seem to persist a bit more and have quite a bit of trouble. And I usually say to those patients, you're not going to get completely better, but with a bit of luck we'll be able to help you 70, 80, 90% of the time. And then you'll just have a little bit of trouble now and again. But as I say, I suspect the patients that I don't see, the mild ones who see the general practitioner, probably get better altogether.
There are many ways to treat the irritable bowel syndrome, but firstly, you must go and see your GP, and you won't be wasting his time. I'd advise you to keep a diary so that you can identify what specific factors trigger off your bowel problems. You may be referred to a specialist who can run a series of tests to find out whether it is this condition and ascertain what is the cure for you personally. The important thing is to diagnose and understand the problem as soon as possible. Relax, don't worry about the condition. It won't harm you or lead to anything more serious.
My therapist said to me, you must give yourself at least 20 minutes a day where you completely switch off. If you're just watching the television and having a cup of tea, you haven't completely switched off because you're often thinking, right, well, I'm going to get the tea on now and I've got to get the children put to bed and I've got to do this and I've got to do that. And although you're sitting there and you think you're relaxed, you're not. And she said that really you need some sort of therapeutic music, you need to unplug the phone, close the curtains, lie down and just completely switch off to yourself.
Maybe you could try relaxation exercises, yoga, meditation, or even hypnosis. Dr. Warwell has shown that as high as 80% of sufferers get relief from hypnotherapy.
When one's trying to sell hypnotherapy to an IBS patient, you've just hopefully interviewed them and told them that IBS isn't in the mind, it isn't an anxiety-caused disease, and then you start talking about hypnotherapy, they think, hey, you've just told me it isn't caused by stress, now you're talking about hypnotherapy. Hypnotherapy is good for stress, but it's also good for IBS. And it's the way we use hypnotherapy that seems to help IBS, because we direct the therapeutic effect of hypnotherapy to the bowels, not to the head. And that's how hypnotherapy works. And we've shown in our laboratory that this is how it works, that hypnotherapy can actually affect the workings of the gut. And we've shown this in our experiments, that you can affect the activity of the gut, the sensitivity of the gut. And so we seem, with the aid of hypnotherapy, to be giving the patient the control over the gut to modify its activity. Sort of mind over matter, if you want to put it that way.
I took the course of hypnotherapy, which was absolutely wonderful because it helped with the symptoms. The pain went, it made me feel more lively, took away the lethargy. Generally, it changed the quality of my life.
Really relax. Then on a count of 3, put a hand on your tummy and feel a lovely soothing feeling in your tummy. 1, 2, 3. Feel a lovely soothing feeling in your tummy. Feel lovely and relaxed.
To go under hypnotherapy is very relaxing. Your whole body relaxes. You put your hand on your tummy, you actually feel the warmth. You feel your mind and your body working together. You can feel the warmth going into your tummy. You feel in control. You feel calm. It's a very good feeling. It definitely helps you.
Another case we had recently was a man who had very bad diarrhea with his IBS. So bad that he had to know every toilet in town, and so bad that it affected his work because he had to go in really early in the morning so he could avoid traffic jams, because if he got in a traffic jam he couldn't be sure that his bowels wouldn't let him down, or if the traffic lights were all against him. So he had to get in really early, and then of course when he was in meetings he was always worrying about whether his bowels would let him down. And his life was an absolute nightmare. He was trying to keep his own business going, and his bowels were against him all the time. And I always remember he said to me, I can't even go skiing, my favourite hobby, because I never know whether my bowels are going to let me down. Because this is a fallacy that IBS necessarily gets better on holiday. Some people do, but some people don't. And some people actually get worse on holiday. So just telling an IBS sufferer to go on holiday isn't necessarily the answer to their problems. And we treated this man with hypnotherapy, and after that he was able to resume a normal life again. He was able to go to work at normal times, and I remember him sending me a card saying, I've now gone up in the ski lifts again, no problems, and very grateful that his IBS had been put right.
There are also self-help methods, such as dietary adjustments and antispasmodic drugs, which relax the bowel muscle. 3 popular ones are Colofac, Merbentile, or Buscopan. Now, peppermint oil has also been found to have a gentle, relaxing effect upon bowel muscle, and it is available on prescription as a capsule called Colpermin. 30% of sufferers are helped by an increased fibre in their diet. This can be obtained from fresh fruit, green vegetables, brown rice, frozen peas, and also 2 medications called Fibergel and Regulan. Some sufferers find that a high fibre diet does not help them or even makes them worse, and in that case, a bland diet may prove useful. Now, I have before me various foods. Now, which do you think contains the highest amount of fibre? We have dried apricots, desiccated coconut, dried figs, prunes, almonds, frozen peas, crisp bread, wholemeal bread, muesli, and beans. And you might be surprised that the answer is actually dried apricots that contain the highest amount of fibre, not baked beans. They actually contain the lowest fibre levels across this whole selection of foodstuffs. I'd advise you to take care to avoid wheat, as this makes things worse for 59% of sufferers. Try and have regular meals and also avoid spicy foods. Now, alternative therapies such as acupuncture, herbalism and homeopathy have helped several patients.
Acupuncture helps my irritable bowel syndrome by alleviating some of the tiredness, some of the pain and general debilitation that sort of takes over my body occasionally, and just helps me get through life. If I have anything strenuous to do, I go to my acupuncture and she just helps me over the hurdles.
Some research has shown that about 50% of women sufferers were actually helped by taking evening primrose oil. This treatment had to be continued for 2 to 3 months.
Never let your IBS beat you. That's the important thing, because IBS will get you down if it can possibly do so. So be positive about it. Try not to let it beat you. Try the various things. Read about it. Learn about it. But don't believe everything you read, or don't adhere to everything you read. If you hear that a particular diet helps everybody, don't believe it. There's no such thing as a diet that will help everybody. If you read of a treatment that will help everybody, don't believe it. But try these things, and try anything as long as it doesn't harm you. So if you want to try herbs, you want to try homeopathy, acupuncture, hypnotherapy, yoga, meditation, try anything. And if it works, fine. If it doesn't, try something else. But don't get too obsessed with seeking the cure, but just keep the thing in proportion and try and get help with it, because you can improve it. And very few patients become a total slave to their IBS, as long as they're given encouragement and as long as they're helped in some way.
Now, there are 2 associations you can write to for help. First of all, there's the British Digestive Foundation, and there's also the British Society of Medical and Dental Hypnosis. But there are also many books on this subject. Now, if you have irritable bowel syndrome, you're not alone. You have a real medical condition that can be helped effectively, and there will be an end to your symptoms given that you receive the correct treatment.
So the take-home message for patients with irritable bowel is, you're not neurotic, it's not in your mind, and you can get help.
I do hope that you found this video useful, and I wish you all a speedy recovery. Goodbye and good health.